Thanks for joining us. Dr. Joshua Beckman is with us from Vanderbilt University. Interesting call from Ronnie. He's getting different advice from a surgeon and his cardiologist. He had 10 stents?
A huge number.
That's a stent is something that's put into an artery or vein or something to open it up?
That's right. It's like it looks like chicken wire, and
Yeah.
it becomes a tube, and it keeps the blood vessel open.
Wow, and so those got clogged, and he had to have bypass surgery, and then his cardiologist or his surgeon said, I want you off Plavix, which is what, a blood thinner?
Plavix is like an aspirin kind of blood thinner.
Okay, and so why do you imagine the surgeon would say, I want you off that now, and his cardiologist is saying, no, I think you still need to be on it?
Yeah, so my guess, and obviously I'm not his physician,
Okay.
but my guess is that when he was bleeding, the last thing that the surgeon wanted was a really powerful aspirin-like medicine because I'm sure he wanted Ronnie to stop bleeding. But I think his cardiologist is right, that in the long term, Plavix is a way to keep those bypass grafts open and reduce the chances of a heart attack coming later on. It's a really good medicine, particularly in people who have such severe heart disease like Ronnie does.
Okay, and basically, when we say something's a blood thinner, how does Plavix or even aspirin work?
Right, so we have several different kinds of cells in our blood. We have red blood cells that carry oxygen, we have white blood cells that fight infection, and we have platelets. Platelets, one of their main jobs is to help us when we're bleeding stop up the hole.
Okay.
But unfortunately, other things that platelets can do is that when we have blockages, if the blockage becomes active, the platelet can be involved in blocking the whole blood vessel. So when we give aspirin or Plavix or some of the other medications like it, it stops the platelets from being so active and creating a total blockage in the blood vessel. So it it'll decrease the chances of things like heart attack and bad events from heart disease.
Makes them less sticky?
Exactly right.
Less sticky. So thus, though, if you're taking a lot of that, you cut yourself, you might find you don't stop bleeding as fast as you would have in the past. So you have to be careful. That's why the surgeon would say, hey, we just cut you open a second time, you've been bleeding, stay off that until you heal.
That's right.
Makes sense. Okay. Well, again, he needs to consult with his doctors and
that's right.
You know,
and I think his cardiologist is on the ball. He kept him alive through 10 stents.
Yeah. So
right. I mean, that's
a lot.
That's a lot and a long road.
Okay. Let's go next to Randy. Hi, Randy. Good morning, Randy. Are you there?
Good morning.
Hey.
Yes.
Go ahead, sir.
All right. I'm Randy Blevins, and I've got 63 years old. I got diagnosed last year about this time with congestive heart failure. I'm on quite a few different medicines. One of the issues that I have, my blood pressure was up to like 180, 190, and then with the medicine, it's cut it down to about 130, 140, and a lot of times a little less. One of the things I've found is that a lot of times my blood pressure will be down to about 120 sitting, but standing can go down as low as 80. Is there a reason for that?
So yes. So a couple of things. First, I'm really glad they've controlled your blood pressure. Blood pressure is a really strong contributor to heart failure. Heart failure, for those of you that don't do this for a living, is generally when you hold on to fluid and you get short of breath.
Okay.
So unfortunately, he has a bit of heart failure, but there are a lot of medications now that can make you feel better and live a lot longer, even if you have that condition. Now, his dropping of blood pressure from 120, which is a great number, down to 80, that's a big drop, and it suggests a second issue. It suggests an issue that he should probably talk to his doctor about, but it sounds like the blood pressure regulating systems, the adrenaline-based blood pressure systems, aren't working as well as they should. And so when his blood vessels are having a hard time keeping his blood pressure up when he stands up. And that's when we all stand up, what gravity wants us,
pulls everything
down.
Sure.
The blood vessels are not constricting enough to keep the blood pressure up. And it may be one of his medicines. It may be that he's a little dehydrated. It may be some other medical problem, but I think he should really consult with his doctor and talk to him about it, or her about it.
Gotcha. Okay, let's go next to Jewel. Good morning to you, Jewel. Top of the morning.
Top of the morning, my friend.
Hey, how are you?
Good to hear you and have this beautiful man up there You never fail to provide a sumptuous brain feast on your program. I always enjoy it.
That's going to be our new promo, MorningLine, a sumptuous brain feast.
I like that.
Thank you, Jewel. Thank you.
Well, I just tell it like it is, my buddy, my pal.
All right.
Listen, I take an aspirin every morning with my first cup of coffee. It ain't no 81 Johnson & Johnson special, just a plain over-the-counter aspirin. And I was wondering about that. And anything you could elaborate on about that, I'd be glad to know. Thanks again for taking my call. Y'all have a beautiful day.
Thank you. Now, I know some people get tummy upset from aspirin, especially if you're mixing it with a coffee. I know some people would take those old, they're still there, the children's aspirin, which are a smaller dose.
That's right.
What about what he's doing?
I think that's such a timely question. I'm really happy you brought that up. There was just a really large clinical trial that was reported at the European heart meetings. And it was a trial looking at whether or not aspirin helps people if they don't have any kind of heart disease or stroke or anything like that. And the answer is really, really tiny if it does anything at all.
Okay.
And so I think that we used to put aspirin as like our #1 thing to do to prevent heart attacks and strokes. It is no longer our #1 thing to do. I think the benefits are really small. And in fact, you're right, exactly right. The tummy upset and the chances for bleeding almost outweigh the benefits you get from it. And both of those events are really unusual. And the vast majority of people who take it, if they haven't had a heart attack or they don't have heart disease or stroke, they get little to no benefit.
Okay.
I think at this point, what he really should do is get his cholesterol checked and his blood pressure checked, because fixing those problems, that has huge amount of benefit and over a long period of time.
So, but it sounds to me, and I'm not sure with Jewel, if he has actually, he's in pretty good health, and he's just doing this in his mind because the studies have been out there as a precaution. I guess, I don't know if he's been doing it for years, if it hasn't caused a problem, whatever, but if he stops doing that, it's probably not a big deal.
Probably not, based on the studies.
But the aspirin, or as we said with our last caller, Ronnie, the Plavix or whatever, that sometimes comes into play with patients who have had issues.
That's right. Our last caller is the total opposite of someone who's doing fine and just trundling along, right? Our last guy had 10 stents, and he had open heart surgery with 4 bypasses.
Yeah.
For him, it's all hands on deck, and he needs all the medicines he can get.
Okay.
What I would rather for our recent caller, 30 minutes a day of exercise, making sure that his breakfast is not cheesy eggs with
bacon,
bacon, etc.
Can you eat cheese?
Yeah, of course you can eat cheese.
Can I have a Big Mac?
I'm sure you can. I'm not going to stop you, but I would say we have about 20 or 21 meals a week.
Okay.
I would try and make sure that about 18 of them are pretty good.
Yeah. That's a good way to look at it. I never thought. Yeah, of course, 21 meals maybe if you have 3 a day, and then pretty good. So when you say pretty good, that's like Big Mac, fries, milkshake?
You really want to add a lot of color to your diet.
Okay,
fruits,
chocolate, milkshake,
vegetables.
ketchup with the fries? No.
Maybe some mustard for yellow? No. Fruits, vegetables. You want to vary the kind of protein you're getting, or fish, chicken or turkey. Obviously, I'm not telling you to cut out red meat entirely. Yeah. Because I don't think that's reasonable, particularly with all the food that's available in Nashville and Tennessee. Yeah. But I would limit it.
Okay. And salt intake maybe.
Right. So obviously, the Heart Association suggests we get about 1.5 grams of salt a day or less. It's hard to do that in Tennessee. I'll just be straight up.
Salt is flavor.
That's right.
Salt and fat are both flavor.
The more you can reduce it, the better. And so I'm not quite sure. I think that we can all be better, right? If I had one takeaway message from our conversation, it's that no matter where you start, you can take a step towards getting better.
Absolutely.
And you don't have to do everything at once, because that's hard. Choose to do 1 or 2 things. Park further away, walk to work. Yeah. Always have some vegetables with your meal or with your dinner. Things like that can make a big difference.
Yeah, I mean that's a great way to look at it. Some people have so many, like, where do I start? Just a little bit and can make a huge difference. Obviously, some things bigger than others. If you can find a way to quit smoking, Huge.
Huge.
Huge. That's probably at the top of the list.
That's right.
All right, quit smoking. And then other things you can eat, just as we wrap things up, dark green leafy vegetables or things that have antioxidants. You always hear antioxidants. I don't know. Is that supposed to get rid of things that are oxidizing your blood and everything? I don't know.
So I think we used to think about antioxidants as being a key component, and they're certainly, they do good things, but I think it's more of the eating of the right fruits and vegetables. Probably one is a substitute for the wrong kind of other foods, but also for all the health benefits they bring, the vitamins, what they do for your digestion, how they affect the different bacteria that live in your intestines and colon, what they do to your cholesterol. It's all the greater the assortment of foods, including the healthier things, the better you're going to do. I would put it this way. If you're a car, your food is your fuel. So if you're going to put in, and I'm going to quote you, crappy fuel, your car's going to run crappy. You put in the right fuel, your car's going to run well.
It's amazing how many people baby their cars but put crap in their bodies. Doctor, a pleasure. You're terrific. I really appreciate you coming on.
Thank you so much for having me. This is great.
Sure.
Go to the Heart Walk.
Go to the Heart Walk. I'll have the information on that when we come back. Stay with us.